We're here in the nation's capital to discuss the World Healthcare Congress and the Health Value Awards.
Some of the best and brightest minds in the medical industry gathered to exchange ideas and explore solutions to the most pressing challenges being faced, with the ultimate goal of preparing future leaders in healthcare and to help shift the dynamic of the system from reactive care to a more proactive management of total health.
In order to better understand what this amazing event is all about, we speak with Brian Klepper, who is an advisor to the World Healthcare Congress.
The World Healthcare Congress is an annual conference for the healthcare industry. It's the largest of the year in the industry that brings together healthcare business and focuses on issues of healthcare business.
So the Congress developed this event to bring these businesses together to create awareness for the companies that buy healthcare.
We established the Health Value Awards to identify healthcare organizations that genuinely deliver better health outcomes at lower cost. And make them known to the public and to people in the industry. And that's a really important function because otherwise that kind of information gets just lost.
The hope is that by showcasing these innovative methods, other providers throughout the country will replicate these ideas and deliver lower cost, affordable healthcare for all citizens.
3 groups are invited to the conference: benefits managers for employers, benefits consultants, and high-performance vendors. Attendees are invited from across the globe to participate in activities, network with other like-minded industry leaders, and listen to keynote speakers. We sit in on a keynote from John Mackey, the CEO of Whole Foods Market, who shares his insight on the importance of diet and lifestyle in preventing poor health and disease.
If you look at the major causes of our health problems today, these are obesity, heart disease, cancer, diabetes, and autoimmune diseases. These are primarily dietary and lifestyle diseases. You can prevent and reverse disease simply through dietary and lifestyle changes. Thank you very much.
There's so many doctors in the marketplace, and they all claim to be best at what they do. How are you really figuring out who brings out the best outcomes for the patient?
We ask for data.
Okay.
We have a very serious, rigorous vetting process that asks people to show us the data and show us how they calculated it.
Congress also asks for patient testimonials and contacts these individuals directly.
And most importantly, we'll ask them, are they willing to financially guarantee their results, which most people in healthcare are absolutely not interested in.
Just for the public that would be viewing the show, what could their takeaway of the Health Value Awards be?
They probably won't see it as impacting them much directly right now, but it's an effort to move the industry to a place where it feels forced to actually do the right thing rather than just for money.
The Health Value Awards recognize leading medical businesses for their innovative systems that deliver a high value with lower cost than conventional approaches.
There's already a huge buzz amongst the healthcare industry across the world. Why do you think it's already known in its first initial season as such a prestigious thing to be winning?
Well, everybody wants to be known as delivering value, but the fact is that most healthcare in America particularly is very low value. It's a spotty quality at best. It's exorbitantly priced, and these organizations, as part of their mission, are all doing much better healthcare at much lower costs.
Medical professionals are very excited to see a congressional organization step up and shine a light on these progressive practices, adding yet another level of validity. We speak with some of the finalists that are disrupting the healthcare industry. The Bonati Spine Institute was nominated for a Health Value Award in the Direct Care Provider category due to the fact that the practice guarantees its work, which is unheard of in the spine industry. This is a prestigious award for those who can set examples within the healthcare industry.
We can guarantee the results because the technique that we have in our hands, that is patented by us, is so effective that is going to create results that they are unheard today.
It's been a very interesting conference listening to all the speak down there, because these are folks that are looking to disrupt the healthcare industry. They understand that too much is being spent and they're not getting the quality, so they've gone on a journey to find high-performance centers, and I think that's what they have found with the Bonati Spine Institute.
Jim Milloway created a new supplemental program that contracts with local providers, allowing health plan members access to the precise cost of services.
Think about it like anything you can schedule: MRIs, CT scans, knee replacements, ACL repairs. We help self-funded employers get direct to the source, right? Connecting buyers and sellers, flat fee, case rates, totally transparent for the employer. Big savings to the employer in the 40 to 50% range, and free to the employees. The zero means you pay zero out of pocket.
And so why do you think you were nominated for this award, and what would a win mean for you and the company?
Not just for what it would mean for the exposure, but I think the tough thing about healthcare is for employers and brokers and consultants to understand there really are solutions. So the credibility that it gives to the space, including to our competitors, would be important.
Dr. Keith Smith, the co-founder of the Surgery Center of Oklahoma, rattled the healthcare industry by providing information not readily accessible from other facilities.
The Surgery Center of Oklahoma has been open 21 years, and we've been quoting prices over the phone now the entire time. But 10 years ago, I launched a website where I posted all-inclusive prices for over 200 procedures at our facilities. It shows a lot of courage of the nominating committee and Vidar Jorgensen to select a facility like ours that has really created a lot of disruption and made really no friends in the larger industry. It will encourage, I think, other facilities and hopefully some price gouging hospitals to follow our model and treat patients medically and financially fairly.
David Hoke at Walmart is recognized for raising the bar on how corporations can encourage associates to be an active partner in their overall health and well-being.
Basically, I have the responsibility along with a lot of other people, of looking after the overall health and welfare of our workforce, which, as you probably know, is about 1.6 million people in the U.S., or about 1% of the workforce. I think the Health Value Awards is a great honor because you really don't apply for it. You're nominated for it. So someone is observing what you do and then saying, this is really good enough that it should be held up.
The Health Value Awards are about to start.
So why don't you follow us inside and we'll see who wins.
Master of Ceremonies Ian Morrison introduces many categories and announces this year's winners.
In the honorary category Lifetime Achievement Health Benefits Innovation, the silver finalist is Barbara Barrett of Langdale Industries. The gold finalist, David Hoke from Walmart, and the diamond winner, Harris Rosen from Rosen.
With many of the awards already handed out, we get a chance to speak with some of the professionals who received one of these prestigious awards.
We're absolutely stunned. We're a small company. We've been doing this for 27 years, and never did we think that we would gain this kind of recognition. It's amazing and dumbfounding.
We're trying to balance making sure we control our costs, control our spend, while also maintaining our employee experience and making sure that we continue to have a really good experience for our employees. And so I think this is just kind of a validation that's what we did.
It feels great. There's been over the last 10 years of work that we've been doing to really improve healthcare for our employees and families.
And what a wonderful opportunity to be recognized by your peers, a reflection of all the hard work of not just myself, but the team and our associates across the country who have really contributed to help make this what it is today.
There are 47 finalists and 11 diamond winners who provided the best health outcomes at the lowest possible costs that are nominated by a group of outside consultants. Lynn Crawley, the World Healthcare Manager, explains just how these winners are chosen.
You started out with 350 people
nominees,
in the pool, nominees in the pool.
Yes.
Where did you find the initial 350 and how were they narrowed down? What was that process like?
We had a group of consultants that we worked with who nominated people who they thought would fulfill the mission of the Health Value Awards program. And then the judges went through our applications and boiled that down to 47 finalists and ultimately 11 winners.
The winners in each category received silver, you had a gold winner, and then a diamond winner.
Yes.
Is that essentially just first, second place? Why did you pick those as?
The reason why we did that is because the scoring by the Validation Institute and by the judges also, was very close. And what separated some of these categories were just decimal points. Wow. And because the scoring was that close, we decided to recognize the top 3 winners, silver, gold, and diamond.
Washington, D.C. was picked as the backdrop for the Health Value Awards because it is the center of government and policy, which is intertwined with business.
So as you're prepping for next year's award, are you adding additional categories? Can you explain what some of those may be?
Yeah, well, one of the new categories we'd like to add would include the pharma industry to see what they're doing to lower the price of prescription drugs. to create value for the employees of some large employer groups, because we do know that if we don't do that, some of this population will end up in the hospital and costing employers even more of their resources than they expected. So it is worth the employer's time to take that into consideration.
Showcasing such high-level healthcare innovators who specialize in creating quality of care at an affordable rate sets a major example for the rest of the industry and shows that affordable healthcare is truly attainable.
Well, Kimberly, it was a heck of a night. Very exciting. The inaugural Health Value Awards are in the books.
Yes.
We crowned some great winners.
We certainly did.
What do you think?
A lot of great innovators. It had such an exciting vibe to it, being around so many of the industry greats.
Yeah, and the fact that, yeah, it's an award ceremony, but this is not something like awarding somebody for putting out a great movie. These are truly people that are changing lives around the world.
Absolutely, delivering healthcare the way it should be.
Absolutely.
And we can't wait to bring it again to you next year. Thanks for watching American Medicine Today.